Hello, and welcome to Collaborating for Better Care, Strategies for Successful Partnerships Between Health Plans and Asthma Programs, a web-based presentation sponsored jointly by the United States Environmental Protection Agency and America's Health Insurance Plans. We're so glad you could join us today. As our operator said, my name is Tracy Mitchell. I work for the US EPA, and I'll be your facilitator for today's webinar. I'm so excited to be able to bring you these dynamic speakers to share how health plans successfully partnered with an asthma program to reduce asthma-related emergency department visits and the associated high costs of asthma care. They have some impressive results to share with you today, and I know you're going to learn a lot. Today is all about partnerships, and at EPA, we're proud to partner with each of these organizations to bring you this important information. As you can see on the screen, today's speakers include Kevin Fahey from America's Health Insurance Plans, Bridget Burke from Health Care Service Corporation, and Jill Hines-Nesvold from the American Lung Association of the Upper Midwest. The theme of today's webinar is creating strong partnerships. During this webinar, you'll learn how a health plan, like I said, partnered with an asthma program and collaborated to improve health outcomes for children with asthma. They'll share with you their best practices for establishing strong partnerships, and we'll discover how to use data to inform project planning for your asthma initiative. Great. It looks like we have about a quarter of us work for a government agency. About a quarter of you said you represent a healthcare provider, and almost another quarter health plans. So we have a great variety and great representation of different organizations. About almost 15% are community-based, and about 18% are other. So welcome, everyone. Not surprisingly, I guess, with so many government agencies and healthcare providers, it looks like many of you have connected with community asthma programs, which is great to hear. Hopefully you'll hear some more about doing that. Looks like a few of you have partnered with health plans to offer asthma services, so that's good to hear, and hopefully many more will learn how to do that today. And many of you have not created community partnerships, so thank you for being here and finding out how you may be able to do that. Great. So before we get started, let's just review why asthma is such a significant public health issue. We know that there are currently more than 6 million children in the United States with asthma. Another way to think about this is about 1 in 12 children from the ages of 0 to 17 have asthma. We know asthma is a greater burden in poor and minority children. For example, the national average for children with asthma is just over 8%, but we know that Puerto Rican children have over a 23% rate of asthma. Additionally, there are high costs related with asthma, more than $50 billion a year in medical expenses. We also know that indoor and outdoor environmental factors, including dust mites, molds, cockroaches, pet dander, secondhand smoke, and poor air quality can trigger asthma. But we also know that asthma can be controlled. With an action plan, an asthma action plan, working with your physician, and that includes medical treatment and the control of environmental triggers, we know people with asthma can lead a healthy and active life. So EPA's mission is to protect the environment and to protect human health. EPA addresses the role of the environment in asthma through research, regulatory measures, and non-regulatory outreach and education programs. Most people think about the outdoor environment and regulation when it comes to EPA, and certainly that contributes to our role in asthma. But the Indoor Environments Division, the office where I work, takes a non-regulatory approach that is grounded in science and guidance, outreach and education, as well as partnerships. We focus on the indoor or built environment where we know that people spend up to 90% of their time. EPA's non-regulatory approach has several components, including working with stakeholders to integrate environmental management into program approaches targeting healthcare, housing, and schools, those partnerships that are so important to success in asthma care. Identifying and sharing best practices and tools to facilitate the adoption of effective interventions as we're doing today. We also work at mobilizing community-level action to address asthma and recognizing leaders in asthma through the National Environmental Leadership Award in Asthma Management. Hopefully you're familiar with this award, but each year through the award, EPA shines a spotlight on health plans, healthcare providers, and community programs so that others may learn from their success. EPA is just one federal agency working on asthma. What is the federal government doing as a whole to address asthma disparities? Well, since 2012, EPA has been a co-lead with the Department of Health and Human Services and the Department of Housing and Urban Development on the Coordinated Federal Action Plan to Reduce Racial and Ethnic Asthma Disparities, an initiative of the President's Task Force on Environmental Health Risks and Safety Risks to Children. So what does this mean? So through this action plan, federal agencies have improved collaboration using existing resources and program capabilities to accelerate progress to reduce asthma disparities. And in fact, the working group just met yesterday. So this is a program and a collaboration that continues since 2012. Key areas of focus include spreading access to in-home asthma care services as a complement to clinical care. We know that's particularly important for helping kids and their families learn the skills necessary to get their asthma under control and manage their environmental triggers. Federal coordination is essential to addressing this critical national problem, but it's not sufficient. We know we need all of our regional, state, tribal, and local partners, nonprofit organizations and foundations, as well as community asthma programs to join in our effort in order to support the delivery of in-home asthma care services and create sustainable financing sources. I'll just give you a little more specifics about what the federal government's doing, and here are a few examples. You'll see the organizations that I mentioned, and so HUD has been sponsoring regional and local summits aimed at promoting the coverage of in-home asthma care services by Medicaid programs and private insurers. EPA has been an active collaborator and participant in these summits. For more information and materials on the summits, you can visit AsthmaCommunityNetwork.org under Resources and Conferences, and you'll find all of that information. Our CDC partners have administered the National Asthma Control Program. That's grant funding to state programs to promote coverage for and the utilization of comprehensive asthma control services within those states. Also, CDC is supporting scaling up and sustainable financing for in-home care services through the 618 initiative, which identifies asthma as one of 6 high-burden health conditions. Through this initiative, CDC is partnering with healthcare purchasers, payers, and providers to improve health and control healthcare costs. For asthma, this represents an opportunity to support coverage for in-home asthma care services delivered by community health workers. And under HHS NHLBI, we all know for the guidelines for asthma care, they're in the process of awarding grants to study asthma empowerment collaborations to reduce childhood asthma disparities. These clinical trials will assess community-based integrated interventions from 4 sectors: medical care, family, home, and community, and will include a sustainability component. So as you can see, there are lots of activities and initiatives at the federal level. So we know we have the science through the NAPP national guidelines and other reports which have been translated into policy. The evidence base supporting the role of the environment and in-home visits is in place, and providers are seeing the benefits of addressing the environment. There are best practices and examples translating evidence-based into practice and policies, and that are being widely spread. So now we're in the position to tackle our next big challenge: expand the care outside of the clinical setting by systemically integrating in-home interventions into the healthcare system and getting these services covered. We know that home visits are a critical component to addressing asthma, particularly for the high-risk populations and addressing disparities. These families are often in crisis mode and facing so many other issues that effectively managing a child's asthma becomes a real challenge. Home visits provide one-on-one time that families need to figure out an approach that they can follow to help their child get asthma under control. And as you'll hear today, home visits result in improved health outcomes for people with asthma and cost savings for programs. So I've described the importance of federal partnerships. I've mentioned how EPA is partnering with asthma community programs. And so I'd like to just talk a minute about Asthma Community Network, because this is actually a key to how we are at EPA connecting with asthma partners and asthma community programs. For the past 10 years, this interactive virtual community has connected asthma programs with each other in order to share effective strategies and best practices that are key to achieving positive health outcomes. The network's 1,000+ members have real-time access to other registered programs, to cutting-edge internet tools to facilitate collaboration, problem-solving, and learning, and the most current strategies for making a program thriving and a comprehensive asthma management resource. So again, to fully participate in today's webinar in the question and answer portion, and to access this and previous webinars, I'd like to encourage you to join Asthma Community Network at this time. In order to effectively support, again, the delivery, infrastructure, and/or sustainable financing of environmental asthma interventions at home and school, it takes collaboration at every level. We've talked about EPA's partnerships, again, on the federal level and the community level. Now I'll mention partnerships with other national and regional organizations. EPA has worked closely with several organizations, including two of today's presenters, the American Lung Association of the Upper Midwest and America's Health Insurance Plan. Now I'd like to turn it over to Kevin Fahey, the project manager from AHIP, America's Health Insurance Plans, to briefly tell you about EPA's collaboration with AHIP. Welcome, Kevin.
Thank you, Tracy, for that introduction, and thank you for all that background information for everyone. That was certainly, every time I hear it, it reminds me of how important the project is. So I also want to thank Bridget and Jill for joining us today to share their story. I'm going to be brief, since I know that we all really want to hear what HCSC and the ALA have been doing. AHIP is proud of its more than a decade of partnering with EPA to address asthma. This slide gives a condensed overview of that partnership and focuses on one of the most important results, which is the EPA's annual recognition of outstanding leadership by health plans in the area of asthma management. Health plan winners for the past 8 years are listed here. I apologize if somebody got left out in there, but I think we have everybody there. And we look forward to promoting this annual award application process in the coming months. We're just completing the second year of our current 3-year work with EPA, and this slide briefly summarizes the cycle of AHIP's milestones. As you can see, looking at the graphic there and what's listed here, much of our focus is on communication with our health plan members and bringing them together with EPA through meetings and calls like this one today. And this slide just continues to summarize AHIP's work with EPA and shows a brief glimpse of our information website, asthma information webpage, which can be reached at www.ahip.org/asthma. The graphic probably isn't that great in the middle of the slide, but still gets the message across. And as you can see, these are, again, most of the work we've been doing is focused on communication and bringing together partners. And finally, for our health plan members on the line, whenever we do have a group of AHIP members together, I need to remind everyone that it is AHIP's policy to conduct all of our meetings in compliance with federal and state antitrust laws. And this is not to throw a wet blanket on communication or conversation by any means, but just a reminder that to do so, this means that all AHIP staff and members need to refrain from discussing or sharing any competitively sensitive or proprietary information, including the items that are listed in the bullet points here on the slides. I expect that everyone of our members who are here will be in compliance with that. And finally, just one more promo for EPA's Asthma Community Network. I don't think we can say enough good about that. And Tracy already said plenty, but it's worth repeating here. And also the link is included for AHIP's asthma webpage as well. We sort of backtrack and connect through all these things. My contact information is here as well, and you should all feel comfortable getting in touch with any questions at any time. So thanks again for joining us today. Thanks to everyone. I guess this is one of the biggest groups we've had on one of these calls, so really appreciate everyone joining. And now I'll turn it back to Tracy.
Great. Thank you, Kevin. I'll just say that, at EPA we realize health plans are an important partner in asthma care, and we're thrilled with the work we've been doing with AHIP as an important collaborator in this effort. So thank you for being here today and for collaborating with us on many levels, but especially on this webinar. So now we'll move to our featured speakers. I'd like to introduce Bridget Burke, who is the Director of Public Affairs at Healthcare Services Corporation. Bridget has been there for over 9 years and oversees strategy and implementation for social responsibility activities across the organization, and she's a great resource. Also joining Bridget is Jill Hines-Nesbold. Jill is the Senior Regional Director of Respiratory Health at the American Lung Association of the Upper Midwest, and she has been there for many years as well, has a variety of experience to lend to this, and we're thrilled that you could both join us today. So I'll turn it over to Bridget.
Great. Thank you, Tracy, for including Healthcare Service Corporation in today's call. We're very excited to be here. For those of you who are not as familiar with HCSC, we are the largest customer-owned health insurer across the United States. We operate through 5 different Blue Cross and Blue Shield plans. So we're in Illinois, Montana, New Mexico, Oklahoma, and Texas. We serve more than 15 million members and have about 20,000 employees across our 5 states. I oversee a lot of our social responsibility efforts, which include local and community-wide or company-wide community efforts, volunteerism, diversity inclusion, environmental sustainability efforts, and our employee wellness programs. A key example of one of our company-wide community involvement efforts that I directly oversee is our Healthy Kids, Healthy Families initiative. This initiative began in 2011 and really focuses on finding and funding partners and programs that are moving the needle in 5 key areas. And those are access to food, increasing physical activity, both preventing and managing disease, as well as supporting safe environments. Since 2011, we've invested more than $40 million through this initiative and have worked with about 300 different partners. We've provided more than 19 million health and wellness services, and in 2015 alone, we impacted more than 3.2 million children across our 5 states. And on the next slide, we're going to talk about how Healthy Kids, Healthy Families for us was really a wonderful transition away from the old days of kind of checkbook philanthropy where you're spraying a bunch of money in a community and hoping for the best. This was really our concerted effort to focus on measurable outcomes, tangible outcomes across our community. And it was also an effort to really build mutually beneficial programs and partnerships that really supported different business needs. And a way that we approached this kind of new direction for our company was really leveraging all of the assets available to us. And we found that our claims data was one of our biggest assets across our company. It really helped us to identify some of the most prevalent chronic conditions that are plaguing our members and our community at large. And in turn, what are some of the most costly conditions across our community as well that cost our company a lot of money, but also the individuals that are presenting with those conditions. And so it's probably no surprise to a lot of people on this call that asthma was not only one of the most prevalent conditions, but also one of the most costly. And that was across almost every single age group, all of our geographies, key markets, and product lines as well. So definitely a huge area of opportunity for our company and for our community and for our members. And so we actually reached out to the American Lung Association and said, hey, you're really an expert within this space. What kinds of programs do you have that are really moving the needle that we could possibly deploy across our 5 states? And so we worked together for several months and learned about this wonderful program that they had piloted in Minnesota with one clinic prior to our conversations, and worked to deploy this across all of our 5 states with this real common goal of, between our 2 organizations, of improving health outcomes for those individuals with asthma, while also working to reduce inappropriate and often avoidable healthcare utilization. So I'm going to pass it along to Jill Hines from the American Lung Association of the Upper Midwest to get more into the details about the program itself.
Great. Thank you, Bridget. As Bridget had mentioned, the American Lung Association of the Upper Midwest has an Enhancing Asthma Care for Children program. Bridget also mentioned that this was pilot tested with a much smaller health plan and around 50 primary care clinics over the last handful of years within the state of Minnesota. Our Enhancing Asthma Care program really has three key foundations to it. The first is a partnership with primary care clinics for a 12-month quality improvement initiative. The second piece of our Enhancing Asthma Care program is really a direct service model for those families that have poorly controlled asthma or might be being seen in the emergency room or the hospital multiple times for asthma. So at that point, we execute home-based environmental assessment and remediation programs. This is called our Environmental Improvements for Children's Asthma. And the third key part of our Enhancing Asthma Care program is capacity building through community health initiatives. This is somewhat vague because it would be inappropriate for one of us to sit in one state and make a determination what is needed in Illinois, New Mexico, Oklahoma, and Texas, but rather it gives our statewide managers the opportunity to meet the needs of their local community and find opportunities with their community partners to build the capacity around asthma. A little bit more about each of these particular initiatives. Our Quality Improvement Initiative is working with primary care clinics for a 12-month partnership to ensure guidelines-based asthma care and comprehensive asthma self-management. While this program is led by the American Lung Association of the Upper Midwest, it is implemented locally, nationwide. Over the last 3.5, 4 years, we've worked with over 90 primary care clinics in Illinois, New Mexico, Oklahoma, and Texas, and more currently, we're working with a variety of primary care clinics in Montana. And one of the exciting things about our quality improvement model, it works in a variety of clinic settings. We've worked with large and small clinics, urban, rural, suburban clinics. We've worked with clinics that serve homeless populations, that are school-based clinics, that are residency programs, also that speak a language other than English, and also we've worked with clinics within the Indian Health Service. So excited that this particular model and framework works and is proven in a variety of clinic settings. Our Quality Improvement Initiative has been proven to sustain changes. There's some evidence around quality improvement initiatives indicating that when the spotlight on that particular health disease goes away, then people revert back to their old processes. But our focus really is on institutionalization and sustaining the quality improvement changes over time. And when we are able to do that through our Quality Improvement Initiative, we are able to affect both the health outcomes and the cost savings. Another piece of our Enhancing Asthma Care program is our environmental improvements for children's asthma. We really meet families where they are. Tracy made a good point about how many families are in crises or they just need that one-on-one intensive interaction and attention. And so we provide in-home asthma education, we conduct assessments of triggers in the home, and we make those remediations. We receive our referrals from the primary care clinics we're partnering with if they have a patient that they seem to not be able to control their asthma with medication therapies alone. We also are receiving referrals from Blue Cross and Blue Shield in each of those 4 states as well.
Great, thanks, Jill. And we were asked specifically for this audience to talk about the value of the partnership from both HCSC's perspective and Jill's organization, the American Lung Association. And so we're, from this perspective, really what HCSC brings to the table, I see are kind of 3 main areas. First, obviously, being resources. We are funding this initiative to expand across our 5 states, and we're just entering into our 5th year of this program and have worked to actually increase the funding and provide additional resources resources for programs like the in-home asthma education program, and we're looking at bringing in our newer state of Montana and expanding to different more clinics across our states as well. And we also have a team internally as well that really project manages our program development and the interactions with the American Lung Association and our clinics as well. So we're bringing dollars and people to the table. We're also bringing a lot of data as well. When we formulated this relationship with the American Lung Association of the Upper Midwest, we went to our data to really identify where are our most high-risk members, where are they presenting, and boil it down to the clinic and the provider level, so we could at least have a roadmap and a sense of kind of where the juice will be worth the squeeze in terms of delivering and deploying this intervention program. And then on the flip side, we're able to go back to our data and really track our own members who benefited from this program because they receive care at some of these clinics that have participated, and see if we were able to move the needle and track and look at their medical claims data, a year before the intervention, a year during, and a year after. And Jill's going to speak to some of those tremendous outcomes down the road. And so data is a big asset that we're bringing to this table. In addition to visibility, being part of a large organization, we have the benefit of having a pretty robust in-house communications team, and we're able to leverage their expertise and all the different channels that we have access to really spread awareness about this program, but also asthma in general, to really bubble up some key findings and lessons learned to share with the community at large, and move it beyond the clinics and the individuals who are benefiting from this specific program, and really turn it into a large-scale awareness campaign. And if you go to the next slide, I can show you an example of one of these initiatives. An initiative we recently launched is called Taking on Asthma. And again, it's really to share a lot of these lessons learned, these best practices, and these resources with the community at large. We're really looking at three key focus areas, or kind of target audiences: parents or caregivers of children with asthma, providers, and then schools, and trying to give them stories and content to really help them manage asthma from their perspective and kind of how they touch asthma on a daily basis. And the next slide, we kind of see a little deep dive of one of the pages for parents and the types of topics and stories and content that we're delivering through this channel. And then if you go to the next slide, we can talk about kind of the benefit that HCSC receives from this partnership. I think a big win for us is that it really strengthens our relationship within the provider community. We're hearing directly from providers and clinics that we're finally seen as a partner and not just a payer within this space. We're really giving them the tools and resources they need to meet certain expectations. It also makes us a much more approachable and easier to navigate organization. We often have some of our medical officers or other staff members participating in these programs, and they're right there in the room and working side by side with clinicians to help improve the quality of care, but also to answer questions, kind of who to go to for what. We're able to dispel certain coverage myths and policy inaccuracies right there in the room, again, making us much more approachable and accessible to our provider communities. And then we'll talk about this later, but this program does generate a pretty significant return on investment to our organization as well. So this really speaks to those mutually beneficial partners and programs that we're looking to build. We always want to do good in the community through our community involvement programs, but if we can do good by our company at the same time, we're always going to be looking for those kinds of investments. So Jill, if you'd like to talk about the value from your perspective, that would be great.
I'd be happy to. Thank you. The American Lung Association brings a variety of things to the table. First and foremost is credibility. We are recognized as the lead respiratory or lung health organization in the country. I often tell our primary care clinics that we're partnering with that our goal is to be an exceptional community partner with them. We don't have the ability to regulate the clinic or pay them or withhold anything from them. But what we can do is bring our passion, our expertise, and meet them where they are and be with them throughout the quality improvement initiative. We also have the ability to implement locally a nationwide program. And so, as Bridget had mentioned, Healthcare Service Corporation operates in the states of Illinois, Montana, New Mexico, Oklahoma, and Texas. So not just geographically contiguous, but what we're able to do is take this model through the American Lung Association and implement it in equally and using the same model and fidelity in all 5 of those states. We're also seen as a neutral convener in the community. We're not a government-based organization or a regulatory type of organization, but rather people recognize we're there because we have this deep, strong passion for lung health. We also are able to bring technical expertise to the clinics. We teach everything to the NHLBI guidelines. When we're teaching around spirometry, we teach to the American Thoracic Society guidelines and also bring in expert perspective as well. And finally, we're able to push best practices and quality forward in the clinics in a really friendly way. I think what makes us different than a lot of other quality improvement initiatives is a lot of times somebody is measuring the clinic at some point in time and saying, you know what, let's see if we can do better, and good luck with that. But rather, we are measuring the clinic at baseline with no judgment whatsoever. There's a variety of reasons why clinics might do an exceptional job or have opportunities or room for improvement, but then we're there with a framework that is proven. We bring tools, resources, trainings, proven processes, cheerleading, and everything the clinic needs, and we are their partner every single step of the way. Bridget and I spent some time talking about what are some of our best practices and lessons learned, so we both might have something to contribute to this slide. But one of the things we both realize is we have to be patient because this process takes time. We both work in large organizations, and so sometimes we need to build in enough time to find the answers that may not be within our division. We have to figure out a process. It's a new opportunity for our companies, and then also it's an opportunity for us to bring in new players. This all takes time. We also recognize that each organization has different talent to contribute. One of the things that Bridget had talked about just a moment ago is the breadth and the depth of their communication staff there at Healthcare Service Corporation, and that has been a really great opportunity for the American Lung Association of the Upper Midwest to tap into and move the issue of asthma management forward. And we also are able to ensure that any initiative we take on within the Enhancing Asthma Care Partnership complements other efforts within our organization, and we can make those connections and make sure we're not duplicating each other's efforts, but really complementing each of them. Bridget, would you like to add anything to this slide?
I think that first bullet is probably the biggest lesson learned on our side, is that you have to be patient. You really have to manage expectations up front because we know that change takes time, and that we also know that people want to see outcomes pretty immediately as well. So Jill and I worked hard to kind of figure out what are the more low-hanging fruit or more immediate outcomes that we can at least show that we're moving along the right path, but then one of those long-term outcomes that really proves that this is doing right by these individuals. And so we set that up, up front and early, and really managed those expectations because it took, about 3.5 years to really get to this great place that we are now.
As Bridget mentioned, we wanted to get to the point of measuring impact on health care outcomes and return on the investment, but we needed some interim or shorter term outcome measures. And so what we were able to do is to measure the changes in practice in the primary care clinics. And let me talk you through this slide here. One of the great things is this slide indicates our ability to work with primary care clinics and institutionalize and sustain their changes over time. And so we measured at baseline and then 12 months from the point of baseline and 18 months post-intervention, 6 quality indicators that are documented in the medical record. And we were measuring whether or not they were documented and that providers were actually using these particular quality indicators and practices in their clinic. And so this first slide comes from an aggregate of our cohort 1 across the states of Illinois, New Mexico, Oklahoma, and Texas. And as you'll see that from baseline to 12 months and then also baseline to 18 months, all of our measures were statistically significant at the point O1 level. And so we were able to increase the use of providers using or applying a severity rating to the person's asthma using an asthma control test or other patient self-assessment tool, prescribing controller medications for those individuals with persistent asthma, writing a written asthma management plan, using spirometry to diagnose and manage asthma, as well as providing asthma education. And we use the proxy measure for asthma education as being at a minimum delivering inhaler teaching technique. And as Bridget and I mentioned, we really wanted to get to the point of being able to measure the impact on healthcare outcomes and return on the investment. We're excited that we're the first asthma quality improvement effort in the country to utilize both the health plan claims data to do that, to measure return on the investment and impact on healthcare utilization. So before I describe our outcomes, I want to make sure you understand our methodology. So on the next two slides, we're just talking about the methodology. Our goal was to measure the change in healthcare utilization of individual Blue Cross and Blue Shield members with asthma who received care from one of our partner clinics before the intervention to a year after the intervention. So we started with selecting all the clinics that participated in our first two cohorts in each of the 4 states, and we identified their clinics based on their tax ID numbers. Our third step was to then select the Blue Cross Blue Shield members associated both with those provider tax identification numbers, but also had at least one claim for asthma, ICD 9493, during the year before the project, and were continuously enrolled with Blue Cross and Blue Shield from that year before the intervention to through the year of the intervention to a year after the intervention. I think I really want to drive home the point that these people were continuously enrolled for 3 years. Once we had secured this entire de-identified claims data set, it included both medical claims, DME, and pharmacy claims for Blue Cross and Blue Shield commercial, retail, and Medicaid members. And then we were able to analyze the data, again, from the pre-intervention through to the post-intervention, both for healthcare utilization and return on investment. And on the next slide, we are just thrilled with our outcomes. What we were able to do is reduce asthma-related hospitalizations across the 4 states from before to after the intervention by 56%. Now, I want to stop and describe this a little bit. As Bridget and I had mentioned, this program is called Enhancing Asthma Care, or Enhancing Care for Children with Asthma. Notice the word children. But one of the wonderful things we found is family practice clinics that we work with, they don't change how they provide asthma care when somebody turns 22 or 23 years of age. Rather, they change their asthma practice throughout the lifespan of their patients. And so while our target was pediatric asthma, we had a significant impact throughout the lifespan. So here you'll see the combined reduction in asthma hospitalizations was 56%, but there was also over a 50% reduction in pediatric asthma, and then those adults 18 years of age and older. I also just want to point you to our sample size. This was a significantly large sample size of over 1,800 Blue Cross and Blue Shield members in Illinois, New Mexico, Oklahoma, and Texas. We were also thrilled with our impact on reducing asthma-related emergency department visits. Again, same sample size, but you'll notice that we had a reduction of 55% of asthma-related emergency department visits across all age categories. And it was very similar for pediatrics versus adults as well. We were able to go beyond just improving healthcare utilization and reducing emergency department visits and hospitalizations for asthma, but we actually were able to measure a cost savings. On this slide, what we did was we took the plan paid amount and the member out-of-pocket savings for both the asthma hospitalizations and emergency department visits that were prevented, we subtracted the intervention costs, and what it equals was the return on investment. So what we found was for every dollar that Healthcare Service Corporation invested in the American Lung Association of the Upper Midwest Enhancing Asthma Care Project, we were able to save them $2.40. Great. I had mentioned another component of our Enhancing Asthma Care program was our environmental improvements for children's asthma. We are not at the point yet of being able to measure our outcomes using Healthcare Service Corporation or Blue Cross and Blue Shield data. We're getting there, but not quite enough time has elapsed. So what we're able to do is look at many of the pilot programs and the reduction and cost savings there. So the findings on this slide come from working with 350 children with asthma in Minnesota, and the data came from Medica Health Plans a handful of years ago. What we were able to do is reduce children's day and nighttime symptoms at a statistically significant level. We were able to also reduce hospitalizations by 68%, emergency department visits by 44%, and also have a reduction in all-cause health insurance claims. So in this particular analysis, we found for every dollar the American Lung Association in Minnesota contributed to the Environmental Improvements for Children's Asthma Initiative, Medica Health Plans saved $2.19. When we get to that point and enough time has elapsed, we will replicate this evaluation with Healthcare Service Corporation. So we're excited to see those findings as well. One other finding is through a separate evaluation of this program working with tribal participants, we found that we were able to increase the number of days that those children with asthma attended school on average of 6 days per year. We were asked to address financial stability or sustainability of our programs. And the American Lung Association of the Upper Midwest, we develop partnerships at the local, state, and regional and national level to implement our proven program. And so this program has been proven that it can be proven at a local, such as within the state of Minnesota, and be expanded and replicated across a number of states, including Illinois, Montana, New Mexico, Oklahoma, and Texas. And so our financial stability really comes from our ongoing partnerships. Bridget, would you like to add how we're moving forward with sharing this with other states as well?
Absolutely. We're here, obviously, to share the tremendous results of this program, but we're also here to really encourage others to look within their communities and find programs that are moving the needle and that are doing the work, really seeing the investment and seeing the change that you're working towards, programs such as these. And, we're putting together, we were talking about earlier, the Taking on Asthma campaign, and really trying to share the stories in many different ways and encourage other health plans to adopt similar programs, because asthma really impacts us all. I'm sure we all know someone who has asthma and could benefit from these types of programs. And so Jill and I are really doing kind of a roadshow to share this story, and again, encourage those that are in a position to support programs like these to do so, to really invest the time and the money, because the results will come. And again, just manage those expectations up front that it takes time, but that's okay. Change takes time, and that's great. And hopefully we've demonstrated that the time and the money and the resources that both Jill and I have contributed to this program are well worth it in the end.
Great, thank you. Thank you both. Before we do that, I'd just like to kind of summarize and share, reflect on a few of the nuggets that you shared. There were so many, and I feel like we could probably spend another hour with you. And so fortunately, participants will have time the next half an hour to ask you questions. But I really want to drive home the point that you both made, that Bridget just said, to be patient, that this took several years, that it was a kind of a labor of love, and you were both committed partners to seeing this through and to figuring out the best way to serve for healthcare services, for them to serve their members, and for the ALA to be a important part of that. So I also love that Bridget said, they're seen as as a partner, not just a payer. And we really are hoping through our work with AHIP and health plans that we really want to drive that point home, that health plans have a really important role, and it's not just because we see them as having the deep pockets. They do have the data. They can share claims measures, and they can demonstrate outcomes through their claims data. So we really are an important partner in this effort, and so thank you for driving that home. I also love the fact, Bridget, you said that this was a win-win. So it's not just, again, a win for the community program. This is a win for the health plan. You're seen as, a good provider for your members, and it's strengthened your relationship with providers. So I think that's great. Jill, you were incredible at describing the layers of partnerships. You're in partnership with all the key players and with everybody essential for health, for asthma management, from the health plans to the providers. And when you described your relationship with the clinics, it just really spans the breadth of from school-based clinics and tribal clinics all the way through. So lots of lessons learned, I'm sure, from you, and we'll look forward to following up with you after you've had an opportunity to evaluate the program and have kind of more current data to share with us. I mean, that's fabulous. Your return on investment data, I think, is very helpful. We've had a few questions come in about that, and so we'll be excited to maybe expand on that in the discussion forum coming up. So before we close, yes, we do have one more polling question. We'd like to kind of just get some initial feedback. So based on what you heard today, what do you feel better equipped, what actions do you feel better equipped to take? So it looks like about a third of you feel better equipped to reach out to potential partners in your community. Over a third are ready to use data to inform your program planning, or you've learned how to use the data. And several of you, about a fifth, are looking at tailoring existing partnerships to better fit your community's needs. So this is really great feedback. You'll also be receiving via email a survey or a evaluation survey. So please take the time to fill that out. That is very helpful for us so that we can make sure that we're meeting your needs and taking the time out to attend the webinar, and also helps us to make sure that future webinars address your needs as well. At this time, we're going to go ahead and close the webinar. Thank you all again for your participation, and have a great day.